Okay, let's jump right into this high-energy explainer of the postpartum period. We're focusing on exactly what you need to know to absolutely conquer the NCLEX. The fourth trimester is heavily tested, and succeeding here is all about mastering assessment and client teaching. So let's get focused and tackle this.
Picture this, you're checking on a postpartum client 3 days after she gave birth, and when you walk in, you find her in tears. She looks right at you and says, "I do not know why I'm acting like such a baby. I feel prepared for my new role."
So, what do? Is this a major psychiatric emergency you need to escalate right now, or is this just a totally normal, expected finding on the NCLEX? We're going to answer this exact question, but first, we need to build our foundational knowledge. Starting with uterine involution and the boggy fundus.
To solve that opening puzzle, we've got to speed run the clinical priorities of the fourth trimester. Involution is simply that rapid decrease in the size of the uterus as it returns to its normal non-pregnant state. As you can see, the fundus steadily descends down into the pelvis day by day.
And here is the golden rule for your exams, the 1 centimeter per day rule. The fundal height decreases about 1 centimeter daily. By day 10, it's descended so much that you shouldn't even be able to palpate it abdominally. It's a highly predictable timeline, which is exactly why test writers love to quiz you on it.
But listen, here is a massive NCLEX trap we absolutely have to watch out for. What if you're palpating that fundus and it doesn't feel firm? What if it feels soft, kind of mushy, flaccid, or boggy? The absolute first action before you call the doctor, before you check meds, is to massage it until it's firm. A flaccid fundus means uterine atony, and massaging it is your critical intervention to stop postpartum hemorrhage. Next up, logic.
Assessing uterine discharge is just as important as feeling that fundus. You literally have to know these lochia stages by heart. First is rubra, that bright red discharge from birth through day 3. Then it transitions to serosa, which is brownish-pink from days 4 to 10. And finally, alba, a white discharge from days 11 to 14. Any weird deviation from this timeline? Huge red flag.
Now, here is a hard line you cannot cross regarding the amount of lochia. While discharge naturally varies from scant to heavy, saturating a menstrual pad in just 15 minutes is excessive. We're talking an absolute clinical emergency indicating severe bleeding.
Moving right along into safety and psych mode.
Okay, so back to our crying mom on day 3. She is experiencing postpartum blues. This is a perfectly normal finding. Postpartum blues involve temporary emotional fluctuations and anxiety. But don't confuse this with postpartum depression, which involves an inability to sleep, zero energy, and feelings of guilt. The blues are expected, but postpartum depression requires immediate medical intervention.
While we're in safety mode, here's another massive alert. The ROGAM reminder. If mom is Rh negative and her newborn is Rh positive, the clock is ticking. You must administer that immune globulin within 72 hours postpartum. This stops her from developing antibodies that could attack a future Rh positive pregnancy.
Let's pivot to client teaching breastfeeding basics.
So beyond your physical assessments, you have to know the how-to for client teaching. The steps for breastfeeding are simple but so specific. First, wash hands and get into a comfortable position. Now for the latch, you don't force it. Teach mom to tickle the baby's lips to get the newborn to open nice and wide, then guide both the nipple and the areola into the mouth to prevent severe pain. And don't forget mom's nutrition. Breastfeeding is a literal metabolic workout. She's going to need an extra 200 to 500 calories a day just to maintain healthy milk production and keep her own energy up. Plus, lots of fluids and continuing those prenatal vitamins. All right, time for an NCLEX rapid-fire quiz.
You've got the knowledge, now let's test it. Imagine you're at the bedside. You note the client's fundus is displaced to the right. What is the very first thing you ask the client to do? Pause and think. 3, 2, 1.
You ask her to empty her bladder. A full bladder is the #1 cause of a displaced fundus. It pushes the uterus up and to the side, and worse, it actually prevents the uterus from contracting, which spikes the risk of bleeding.
And that wraps up our rapid review. Postpartum care is all about the details. So, be honest, did you know the lochia stages by heart? Let us know in the comments, save this explainer for your next maternity rotation, and keep crushing your prep. You've got this.